A lot of problems with fractures. Yes, if they fall, they might break a bone. Yes, if they fall in the playground and fall on their fanny, they might break a vertebrae in their back, but it's transient, it can be treated easily, and it's not, in our experience, a problem that we worry about. So yes, the boys have osteoporosis. Yes, we make it a little worse with the Flazocort, and no, we don't worry about it. Now the other thing is, what about the other side effects that we commonly see with prednisone? We don't see those in boys who have deflazacort, and they are sugar in the urine or diabetes. We're not seeing a big problem with the face having acne and pimples and a lot of hair growth, and we're not seeing problems with hypertension. The blood pressure in all these boys, without exception, has always remained normal. So those common side effects that oftentimes limit the use of prednisone have not been, in our experience, a limitation that we worry about with the Flazocort. Now, this disease, unfortunately, has a lot of difficult decisions involved, both with the children, the other family members, and the parents. And steroids, the choice to take steroids, the time to start them, the dose to use, these are all very difficult decisions. There are many more questions out there than there are answers. We're learning a lot. We have learned a lot. There's a lot more to learn. So what parents, I think, are wise at doing, and by reading this and listening to this information, is that they're going to be able to make a choice. They'll be informed. They can talk to other parents. They can talk to other professionals and be part of the decision-making process. In that way, and I think it's a very positive way, they will make an informed choice.
In the UK, we've decided to make a national policy on the use of steroids in Duchenne muscular dystrophy. And this is based on our feeling that parents need to be offered a choice as to what type of regime is likely best to suit their child. And so we're keen that people are well informed about the results of the controlled trials of everyday steroid therapy, both the positive effects of these trials and also the potential side effects. And parents are explained that this is where the evidence lies for the use of steroids, but also offered the option for an intermittent regime, either 10 days on, 10 days off, or alternate day steroid treatment, which might reduce the risk of side effects for their children. We're collecting the results of this programme in a project which has been sponsored by the Muscular Dystrophy Campaign for audit of practice in Duchenne muscular dystrophy across the paediatric centres dealing with it in the UK.
When the boys come into the clinic to start steroids, we sit down with the family and discuss both the pros and cons of the steroids and outline the regime that we would follow for the families. That consists of the boys coming in every 4 months for a checkup here at the centre, which includes height, weight, blood pressure and pulse recording, and doing the pulmonary function to check their respiratory levels, and every so often doing a blood test to see if that has been affected by the steroids. Initially also we do some counselling about dietary needs when somebody is on steroids, and give the family some handouts on different kinds of low-fat foods, low sugar, low salt, to give them some guidelines as to how to shop and to provide food for their family. There are also certain tests that we require before the boy starts steroids, and that is a bone density test to check the osteoporosis level before they're starting steroids. And we also check whether or not the boy has had chicken pox. And if they have, that's great. We can start steroids straight away. If they haven't, then we need to get a chickenpox immunization vaccine and then wait 2 weeks before the family starts steroids. As well as the chickenpox testing, we also do a lateral spine x-ray to get a baseline picture and also do a bone age x-ray. Then the boys are followed, as I mentioned, on a 4-monthly basis, and during that visit they have a physical and assessment by a physiotherapist to check their muscle strength and record any changes in the muscle strength over time. I would also spend time with the families discussing how they actually take the steroids. Some of the boys have difficulty swallowing pills, so we can go into some ways where you can sort of take them more easily and crush them if necessary, and discuss how to deal with if there is illness and they cannot swallow pills, if they're nauseated or vomiting, And if the family wishes at any time to stop the steroids, to discuss that eventuality and how that should be dealt with. As well, the information, as well as verbal information, the information is also given in writing, so the families have that to refer to, and the families are encouraged to phone us at any time if they have questions and or concerned about any issues. The weight is one of the biggest issues that we have to deal with, and we, as I said, monitor this every time they come to clinic and talk to the families about it on a very regular basis. If it becomes a major issue, we do refer them to the dietitian for some in-depth counselling. The other issue that's a big one is the behaviour. A lot of the boys go through a problem period with their behaviour when they're realizing that they can't do as much as their peers, and that they don't really know exactly why, but they're also getting a little bit older and they understand a little bit about their Duchenne muscular dystrophy. And we find that the steroids may increase that problem for some families. For most times it can be controlled or assisted by meeting with the social worker and learning some behavioural modification strategies, and very occasionally we have to refer to a psychiatrist or psychologist if we need extra assistance.